Good afternoon, everyone. We want to welcome you to the webinar, In-Store Interventions to Encourage Healthier Purchasing, What We Can Learn from the Supermarket Industry, hosted by the Johns Hopkins Center for Livable Future. My name is Ann Palmer, and I'm a program director at the center. Karen Bassarab and Rachel Santo are joining me in the room. I'm going to introduce our presenters and then talk about what they'll cover today and give you a little bit of background about our project. We have two speakers this afternoon, or this morning, depending on where you're calling in from. Dr. Allison Carpin is a Senior Associate Director at the University of Delaware's Center for Research and Education in Social Policy, and an Associate Professor in the Department of Human Development and Family Studies. In her 18 years of practice, Dr. Carpin has published widely in journals including Pediatrics, Preventive Medicine, and Health Affairs on program evaluation methods, topics related to hunger, obesity, school food, supermarket access, food insecurity, healthy corner stores, and strategies to develop and maintain farmers markets in low-income neighborhoods. She has hands-on experience working with community-based agencies and institutions, including retailers, to implement specific approaches to increase access to high-quality food in low-income communities. Dr. Carpin is actually a graduate at the Johns Hopkins University, where she got her bachelor's degree in public health. She has her master's and doctorate degrees in policy, research, evaluation, and measurement at the University of Pennsylvania. And she is a mother to 4 children, aged 8 to 15. Daria Minovi is a policy associate at the Center for Science and the Public Interest. She supports CSPI's research and policy efforts related to healthy retail and leads the Healthy Retail Subcommittee of the Food Marketing Work Group. Ms. Minovi received her master's in public health from the Harvard T.H. Chan School of Public Health and was part of the Food Law and Policy Clinic at Harvard Law School. Prior to joining CSPI, she worked for Health in Harmony, a conservation and development nonprofit in Portland, Oregon, and completed internships at the National Resources Defense Council and John Snow International. Dr. Carpin will discuss supermarket marketing, current research, and trends that we're seeing in the industry. And Ms. Minovi will discuss strategies and policies for improving the retail environment and how CSPI supports jurisdictions who want to work in this area. At the end of their talk, we're going to open it up for questions from you, but you're welcome to write questions at any time during the webinar in the box in the control panel. Before we begin the webinar, I'm going to spend a minute introducing you to CLF. Go ahead. Our center is an interdisciplinary center located at the Bloomberg School of Public Health, and our work focuses on the intersection of diet, environment, food production, and public health. The Food Policy Networks project is one of our projects. The goal of FPN is to build the capacity of food system stakeholders to reform local, state, regional, and tribal food systems through effective public policy. We moderate a listserv of about 1,500 members, conduct an annual survey of food policy councils, curate a database of resources, and host webinars like these. In addition, we provide training and technical assistance to food policy groups around the country. If you're not familiar with us, we recommend you check out the website and sign up for our listserv to hear more about future webinars and other resources. And if you have resources that you'd like to share with us, please send them to us at our attention. We'll be happy to post them on our resource database. We'll send out all the materials after the speakers that they referenced during the talk, after the webinar, including the recording. All of the attendees are in mute-only mode and will remain in listen mode throughout the webinar. And now I'm going to turn it over to Allison to get us started.
All right, you're unmuted, Allison. Well, maybe. Hold on.
Oh, that's good. I got it.
Perfect.
And I'm going to flip over your screens too, hopefully. Okay, does everybody see me on big screen here? Yeah, great, okay. So thanks, first of all, Center for Livable Futures for having me on this call. It was a really great opportunity, I think, to go through some of the more current literature and also reflect a little bit more on some of the in-store marketing approaches that we've been using over the past few years. So what I want to do today is review some of the retail marketing data from 2018. Can you all hear me okay? Yeah, okay. From 2018, including the trends. And I really wanted to focus on some of the retailer emphasized trends, because I think in order to talk the talk and walk the walk with retailers, we should really know what they're reading too. Of course, that also reflects a broader audience, but I think that the way and the terminology that is being used is useful. I'm also going to reflect on some of the newer literature. There's a couple of review articles out, which I want to shed some light on, and then, of course, leave time for Daria and her presentation and some discussion. So the retail trend data that I'm going to be drawing from in the next couple slides is largely from this U.S. Grocery Shopper Trends 2018, which actually has an emphasis on healthy food marketing. So where are people shopping for groceries? In general, we know that SNAP data suggests that Walmart is a really large outlet for retail, although we'll see in these next food marketing trends that supermarkets still maintain their position as a primary store for many. That said, the most recent data that I can get says that 1 out of every 3 shopping dollars is being spent at Walmart, which is pretty substantial. And of course, we know too that the dollar market is growing, though we're not sure how quickly in the next few years. There's about 18,000 outlets in the US in 2005, and that's gone up to 27,000 in 2018, and it's expected to almost double by 2015, and double again by 2018. So we'll see, by 2020. So we'll see what actually happens there. We know that supercenters, of course, then are still a pretty large portion of the dollar. So this is an interesting chart, I thought, looking at the U.S. grocery shopper trends over time. So you can see on the far left, which is the darkest orange column, which hopefully you can see me pointing to, that's 2005 all the way up to 2018. And you can see how the supermarket industry really kind of got chopped away by some of these other markets between 2005 and 2010. And then there's a slower decline from 2010 up until today, where the Food Marketing Institute is declaring sort of a truce on the supermarket, edging away of that market, suggesting that maybe through their online ordering and other mechanisms, they've been able now to hold their share of the market. I thought this was also interesting. I'm sure most of you, like me, spend time thinking about what makes a store a good store and what people prefer. And at the top of the list here from the 2018 trends across the US are high quality fruits and vegetables, high quality meat, low prices, and then product selection and variety. Sorry about that. These other items too are consistent with what we typically measure, right? Fast checkout, knowledgeable employees, and sorry, these chart at the bottom gets a little wonky, but the other interesting thing from this report is that eating well is really emphasized as a goal for consumers rather than the idea of pantry stocking. And I thought this terminology of eating well was particularly interesting because it incorporates both nutritious eating, but also feelings of having good quality food and, enjoyment, right? Well, good. So there's also an emphasis, like I said, on taste and enjoyment, and also this idea of discovering a mindful connection with food, which isn't something I think we think about all that much in public health, but definitely dovetails with what we do, and from a messaging perspective might help sort of bridge the gap between the kind of work that we do and the kind of work that retailers are interested in seeing more of in their stores. This is another element that I thought was important when it came to this eating well component. And so if you think about how you define what eating well means, these are the variety of possible options, everything from eating nutritious food to eating in moderation, what you perceive as a high quality food and beverage, all the way down to eating within your budget. And so I like this overview for a couple reasons. First of all, it's a nice laundry list of items that I think will be interesting as we move forward to compare to a lower income audience, but also it gives us a sense of the range of connections between budget and health. Incidentally, too, the indicators with like the red people versus the blue people, the red people are supposed to be women and the blue people are supposed to be men, and men score significantly higher on the blue ones and women on the red ones. Just some other features of what eating well means. And these, I think, have obvious direct connections to the kind of in-store marketing and nutrition education type work that many of us do. Retailers agree that shoppers really want recipes. They also really want grab-and-go foods, nothing new there. They also like recommendations for nutrition and healthy eating, though if you were to scroll back, you would notice that a dietitian is not really high on their list. How-to instructions, and then placement. And I thought one of the other interesting elements here was the issue of food waste, which I know in our state, I think in part because the Department of Agriculture's emphasis on food waste has kind of risen in the general conversation. And I think to the extent that that could also play into marketing for healthier food, it might be a nice new angle. If you look at expenditures over time, we're still spending between like $105, $109 per week per household on groceries. And the report is that it hasn't necessarily changed that much. Oh, I should point out that in the prior slide, the two lines are different because one is Food Marketing Institute's dollar estimate and the other is from the US Labor Statistics. They're pretty close though, right? If you look at stock up trips, we're still spending, and this hasn't changed in the last couple of years, about 1.5 weekly trips to a store. But now there's more data about men and women, or household partners or multiple people in the household shopping. And so it goes up to kind of 2.2, maybe even a little higher depending on who reports. If you add in other members of the household. And there's a real emphasis on this idea that men are shopping more, the idea that most adults now in a household with more than one member are saying that they do 50% or more of household shopping. So it really made me wonder if we're doing enough to support male shoppers. To what extent are we targeting male shoppers in our nutrition interventions? And also, how well represented are they in the data that we're collecting about shopping in general? I know my data is still very much skewed female, but men actually report taking more trips, which I had to chuckle at, than women do, more back and forth. And so they should be in the store a little more often. And then of course we know about the online trends. There's the new online study that's been, I think, allocated by the USDA to look at SNAP and online shopping. And in general, 28% of shoppers say they shop online at grocery stores. This is up substantially since 2015. And the word millennials is synonymous with online shopping. There's enormous sections of this report that are completely dedicated to understanding how millennials act and how they shop. And as a reminder, I also had to look it up. A millennial is aged 18 to 37. And it's particularly, online is particularly attractive right now to millennials with children. But overall, 34% of all shoppers for the grocery retail industry report are saying that they're online shoppers in some way, shape, or form. And so if we look just quickly at online shoppers and what people are saying about the online shopping and how they're spending more. They are reporting that they have most or almost all the responsibility for shopping in a much higher proportion. They also are shopping at more stores. They have more lists, and they're more likely to have lists for different stores. They're also way more likely to use an app and to look up product information online. So it's kind of interesting that connecting this idea between app use and online shopping, which I hadn't necessarily done before, and understanding, what subgroup is really doing this the most, which is that 18-37 bracket with children, millennials. So I think the big question then is, what do these trends really mean for our retail marketing initiatives? Are we aligned with the market research trends? To what extent do we understand retailer perspectives? And are those perspectives aligned with the families who face more adversity and are receiving and using public benefits? as most people on the call probably know, this is our more traditional, thanks to the Food Trust and Robert Wood Johnson Foundation's report in 2011. We have this nice little chart, right, that overview of product placement, price, and promotion, our beloved 4 Ps. And sort of a nice short list, right? We can probably include in price now incentive programs, which many of us have been working on. But in general, this is kind of the idea, right? And so the question is really to what extent, sorry, my voice is, to what extent are these efforts being effective in the longer term? What do we know about them now? So what's new in the literature? There's a new emphasis from my perspective on retailer perspectives. So a lot of reflection, interview, qualitative work that's been published in the last couple of years on what retailers think of all of this. Sometimes it's a subset of impact, sometimes it's a broader set of feedback about specific strategies, but in general, there's a lot more perspective literature out there, and I'll review a couple. And then feedback from healthy food retail approaches to date. Obviously, there's always growing number of studies in particular about healthy food retail approaches, but there's also a really nice review that just came out too that looks at particularly marketing approaches from the business literature. So I thought I would tap that since most of us are probably a little more familiar with the public health literature. So this is a model that I thought might be useful for people coming from this review article on choice architecture and perspective. So this is a review of 22 retailer based studies that just asked about some aspect of the retailer's perspective on components related to choice architecture. And what they did was, there we go. What they did is they developed this model, which of course we probably all recognize as being connected to the, sorry, I'm having a little screen problems here. Okay, connected to the social ecological model. So, right, we have in the outside ring the social norms and values, and then down to the center, the individual. But this one is all tailored toward retailer perspectives about healthy food marketing interventions and the challenges / potential successes for those kinds of interventions. So I thought it might be useful for this audience as you're trying to nest your retail marketing efforts to kind of tailor it to what we know from the perspectives of the consumer. I should have said the retailer. I should have said too that I have a list of all the references in on my final slide. And I'm happy to share these slides. There's also a document that goes along with this article that I pulled out that's actually the review of all the literature, which I sent to Anne, and if she's going to be sending a follow-up email, you're welcome to share. It's not my review, it's from this Lit review, but it was really well done. Oops. Okay. There's another study out that I thought I would feature that also connects to this retailer perspectives on approaches related to in-store marketing. This one particular one was done by Brian Elbell and team, if you're on the call. They looked at 20 full-service retailers in New York and found generally that deals on the part of the distributor and manufacturer do drive the product selection in the store, but they also do consider customer demand, retail owners and managers when making decisions about what to stock. That said, there's an emphasis in the findings about the autonomy that retailers perceive they have to modify planograms and move product. This is just one example from the article of how that's articulated. Previously, when we first opened, our supplier came in and gave us some basic planograms. For those who don't know, a planogram, right, is a depiction of what products go where in the store, the placement of those products on shelf to get us started. But over time, we've definitely moved stuff, and now it's made more sense. And there's other examples of where they see that there's a lot of flexibility to negotiate and that they're in charge of their store. They also found in asking retailers what they perceive works, that placement is front and center, There's this idea of if you move it, will they come? That was my interpretation. But this idea that you're going to see difference in sales just by resetting something, which I think has implications for our research too, and the idea of how long we expect to leave an intervention in place versus how often we should change it up. There might be something there to that idea of moving it and they will come. Grab and go, we know if you put something in the front, you give it a reasonable price, people might be more likely to try it. And this particular quote was in regard to quinoa, where they were saying in their particular area of the city, or actually I think it was the suburbs, people were less familiar with that product. That said, there's still this pervasive sense of some frustration where people are trying to make these changes, but they're feeling like they still haven't created a breakthrough. And it's a lot of consistent types of efforts to change placement in order to shift purchasing patterns. The final review that I'll talk about just briefly is a review of customer choice and purchase intentions. So this is a really comprehensive review looking at the marketing research literature, as I mentioned, really from the business sector. And I believe in part it was sponsored by RWJF too. And it looks at articles from 2000 to 2015. This one though is only quantitative. The prior review obviously included qualitative because it had a lot of feedback in it. And they review findings related to shelf display, branding, nutrition labeling, food sampling, pricing, and price promotion factors. And I'll go through sort of a high-level view of those impacts now. I thought, by the way, that some of these are really interesting and were new to me, so hopefully they'll be new to you too. When it comes to shelf display, we know that the more attention someone pays to a product on shelf, the more likely they are to choose it, right? So if you can attract attention, draw a head to stare at something for longer, they're going to be more likely to choose it. Which means too that product location is a critical factor in choice, and there's still evidence around the idea that putting something in the middle of the aisle is beneficial, along with sort of our end caps and secondary placement. They talked about secondary placement on aisle 2 related to produce being particularly valuable, and that the more that those outside of the store products are beginning to be infused in the middle of the store, the more they're also seeing increases in sales of those products. One of the interesting elements that I found that was new to me is this idea of shelf-based scarcity to create a sense of popularity. So this actually happened to me, and maybe this is why I like it so much, where I was going to the store last night and I don't remember what I was looking for, but I noticed that it looked like, you know, everything's perfectly stocked, and then it looked like something must have been on such a good sale that it was almost all gone. It turns out it was like a cracker product I didn't need, but I spent a long time thinking about whether I needed that product. So I think there is something to this idea of shelf-based scarcity, but you have to be careful, and the article points this out too, that it can't seem like it's a result of some kind of disorganization or that other people are touching your stuff and that it's messy. It has to seem very neat except for this moment of popular product. So this idea of taking something off and putting it back also will create a reliance on familiar brands. And this sort of reminded me of those stores that may have less staff or just are not as well run, where you can feel the chaos on shelf. And in those cases, which may also be some of our lower income stores, it may put you back on a reliance of a familiar brand as opposed to, say, a cost-saving, lower-cost generic brand. Speaking of brands and brand familiarity, it does really matter, and you're more likely to select a brand that you know, except for in a few categories. And actually the grocery retail the FMI report also points out what those categories are. I'm not gonna remember them all, but we probably know them. Produce, milk, maybe some bread. Anyway, I think this idea though of thinking about the products that are, you know, where there's a lot of brand loyalty and where there's really good options for in-store product marketing is also really important, both in terms of the placement and the price and the win for the retailer, because they usually make a little more money on private label. So the purchase of private label brands is largely dependent on the product category. We know that different categories perform differently when it comes to private label or not. There are also these three fundamental components that were identified in the literature: a financial decision that you make, a functional decision, and then also this idea of a social risk that's associated with choosing a private label over an actual brand. That those are the three major determinants for that decision. There's also some research that suggests that mimicking the national brand in your packaging works, in that you're more likely to believe that it's similar product inside and a better quality than a national brand that has no color style, like the one that is, a private label brand that doesn't have the same color or style as a national brand. Brands with multiple product lines, like a Cheerio kind of product, will benefit from lift as people extrapolate the product qualities to those other kind of sister products, even if it's not necessarily the healthiest product. And there's an interesting set of studies on drink color that say that when you're overwhelmed with a lot of decisions, you do rely on color, which I don't know what to do with necessarily in our world, but I think it's a fascinating finding, because I think, again, that's really true. I do wonder about clear color beverages being perceived as being healthier, especially when it comes to carbonated beverages. And then nutrition labeling. So we know that motivation and knowledge do drive use. It's not just motivation and it's not just knowledge. And the evidence suggests that knowledge is a precursor to use. We know that customers do walk around with these preconceived biased impressions, and that objective information can increase or decrease choice if it's counter to that preconceived impression. So basically, you can change someone's mind by telling them that something is healthy when it's not, or telling them that it's not as healthy when telling them that it is healthy if they believe it's not healthy, and vice versa. We also know, and I thought this was really interesting, the differences for how labeling systems can influence purchases. So if you think about labeling systems in sort of two different veins, one just being the single icon, like green leaf or something, or what they're calling a reductive label. They found that the single icon, which they're calling an evaluative label, works best when the customer is actually comparing products, whereas having the numbers or that front of pack labeling system is better for evaluating just a single item when people want to know what's in this, as opposed to which one should I choose. So I thought that was particularly interesting, especially in light of the red, yellow, green kind of efforts that we do. Then there's this really quirky study that looks at the front of pack and how it can influence children's purchases. And perhaps it introduced for me the idea of a backlash effect, which was this. So this particular study provided children with a range of potential cereal options, several of which indicated a statement like, good for you. Not healthy, good for you. And what happened was that even after children received nutrition education, they had separated the groups of kids a couple different ways. It created this backlash effect where they just still went for the most unhealthy choice. So I think, this is a segment of 8 to 12-year-olds. For kids, we might need to think about this a little more, not just what you're marketing in terms of the one product, but what is the possible selections, and how do we maybe isolate products so that they're not compared to other good for you items, making them want to select something less healthy. Food sampling, I think, is a staple strategy that many of us have used for many years. It continues to work well for healthy items and also for unhealthy items. The one new suggestion that I read is that you should provide the food sample at the beginning of the shopping trip, so that people can enjoy the sample and still have the money left to buy it. So I thought that was an interesting idea, do it at the door. Price promotion. So I recently was on a plane, stuck on a plane with someone from Kellogg, who explained to me that a long time ago, Kellogg, not a long time ago, like 3 years ago, but Kellogg would modify its price promotion for low-income customers based on the time of month, so that at the beginning of the month, they would do like a stock up and save. And at the end of the month, they would do a simple price reduction strategy. And I thought, wow, wouldn't it have been nice to have known that when, as we're rolling out all these incentive programs. But some of the price promotion literature also supports these kinds of ideas, maybe not in such a sequence, but the idea of an 8 for $8 multiple unit price promotion does work to increase quantity. And the suggestion is that higher numbers do lead to more purchasing than lower numbers, like a 2 for 2 versus an 8 for 8. But that strategy only works for products that people perceive themselves as consuming a lot, right? So it's not going to work on maybe toothpaste, but it could work on produce. It's also recommended that you frame it against the usual price so that you can foster the individual to make some kind of comparison. But there's also pretty clear and specific recommendations from literature about what you should put on that frame. So if it's not a very high percentage off, you should frame it as the exact amount. So I put an example of 20 cents versus the percentage off if it's a high enough percentage, like 40% or higher. That said, people can't really calculate how much off that really is. And so if they're shopping on a budget, you might need to help that extrapolation happen at some other point in the transaction. The last thing is there's good data around, or one study looked at wording and the idea of alliteration, like 2 Twix for $2, which they suggest facilitated message processing, where if you're using that same sound at the beginning of the word, that's going to foster people to remember and purchase items. Unexpected in-store coupons, which stimulate impulse purchasing, they do, especially for what people consider treat items. So if you are, suggesting that something's a treat, you might be able to offer an in-store coupon in order to stimulate purchasing as well. There's also some interesting negative effects on price promotions, which show that they can decrease sales of that item after the promotion ends, which I think is interesting in our world. Are we spiking things just to have them decline later? This especially happens when the discount is potentially large. So if you offered something at 50% off or 40% off and then it goes away, people will transition to another product before they'll come back to that one. There's an interesting study that looked at the trade-off, and if you're going to get free money, would you buy something that you perceive as being more expensive? And the answer is not really. I still want a deal, and I don't want to buy something that's not on sale, even if it's not actually my money. And I thought that was interesting too with regard to all the incentive programs that are going on. They also have some data that price promotions are pretty individualized, and that it relies too on how people's decision-making styles are. When you're marketing to them, thinking about the utility of the product, sort of the functional use, or whether or not it's a feel-good benefit. Feel-good benefit appeals to both. Utility is really only beneficial to those who have more of an analytical personality. Then the factors that are leading to less healthy purchases, we know that implicit beliefs about the relationship between taste and healthy eating is still real. So you're going to be less likely to purchase a healthy food if you think healthy tastes bad. And this one was interesting, bringing reusable bags to the store. There's a study that looks at people who brought reusable bags and suggested that you felt so good about your decision to save the earth that you actually deserved a treat and would buy yourself more junk food. Making multiple choices in a row and following a list with details. This is the idea of just getting exhausted in your mind. So if you're following something really carefully, and I was wondering about this too with regard to men, say getting a list from their wife or something that has really specific information, and then getting tired of following that list and then you need a treat because it gets hard. So apparently, if it's too difficult, the list that we make, you'd be more likely to splurge. This idea of real-time feedback, I think, is one that a lot of apps are starting to use, where you can keep track of how much you're spending as you go along, which one would intuitively think that if you're on a really tight budget would be really beneficial. But some of this early data coming out is suggesting that it's actually might be stressful and triggers you to want to have a treat, particularly for someone on a budget, but may be considered more useful for those that are on a budget. Paying with cash is still more painful, and so you may be less likely to purchase healthy food if you're paying with cash. And if your idea of shopping is to, sorry, I just got 1 minute. If the reason why you're shopping is for enjoyment, you're definitely not going to want to buy healthy food, or less likely. Small aisles may have you have more varied choices, and I thought this one was interesting about smells. So if there's smells in the store environment, it actually increases the number of items selected that are not on your list or required, that you perceive as being not on your list or required. It didn't provide more information about the kind of smell. Like, I don't know if it was a food smell or if it was just like a lovely floral fragrance, but I thought that was interesting to even think about the smell in the store. So overall, there's a dearth of retailer information really generally available within the literature. These are a lot of selected studies that were pulled together in this really nice review. And like I said, I sent Anne the summary of all the different studies which were provided in that article. There are more reviews that are coming out, I think, on the way, but they still do neglect many details about our particular audience. And we also see a few long-term studies where implementation has occurred for more than a few months, and we also don't know the impact of things as they go up and down, say like incentive programs, whether or not that changes overall purchasing. And as I said, here's a list of citations, and I certainly welcome questions as they come. Oops. Thank you.
Thanks, Allison. And next we'll go to Daria. Daria, you can just jump in and start sharing your screen.
Okay, will do. Okay. All right. Can y'all hear me and see? Okay, wonderful. Thanks so much, Allison, and also to CLF for having me on today. I will do my best to get through it all so we have time for questions at the end. My name is Daria Minovi. I'm a policy associate at CSPI, or the Center for Science and the Public Interest, and I'm excited to be here today to talk about our healthy retail work. So for those who aren't familiar with us, CSPI is a consumer advocacy organization based in DC, and we've been the leading authority on nutrition issues since 1971. So we focus on advocacy, policy, education, and litigation to make it easier for all Americans to eat healthfully. And one thing that makes our organization particularly unique is that we don't accept government or industry funding like USDA, FDA, Kellogg Foundation. And this ensures that the education we provide is purely science-based and unbiased. So that's just a little primer on us. So I know everybody here is pretty familiar with retail, and Allison just gave a great primer to this conversation, but just want to spend a little bit of time setting the stage for why we focus on retail and what we focus on. So historically, many retail interventions have focused on convenience and corner stores, but we specifically focus on changing the retail environment in grocery stores. This is because Americans get more than 60% of our calories from grocery stores as compared with other food retail outlets, as you can see in this little bar graph here. In addition, the vast majority of SNAP dollars are also redeemed in grocery stores, mid-sized grocery stores and supermarkets. And so to us, from a systems perspective, to have an impact on all levels of population, we think that grocery stores are the place to focus. So we also know that Americans underspend on fruits and veggies and overspend on refined grains, fat, and sweets. And so it's no wonder that these are our shopping habits when the odds are literally stacked against us in a grocery store. I think everyone here has experienced this walking through a store that junk food like chips and soda and candy are stocked at store entrances and on end of aisle displays like this, in dump bins, and in these elaborate theme displays like this March Madness soda display that we saw in a store last year. A recent study on in-store placement and promotion found that on average, sugar-sweetened beverages appear in 25 and unhealthy food in 40 different places across the grocery store. And putting products on end caps and at checkout is not an accident. As Allison said, it's an extremely powerful marketing technique, because it induces impulse purchases by consumers and also boosts sales. And customers often don't recognize preferential product placement as a form of marketing. So to better understand this problem, we looked into how and why certain products end up on store shelves and specifically at checkout, and the results are in our report Rigged, which I highly recommend you read if you haven't already. So we wondered, is it really all due to consumer demand? And we found that there are deals between stores and food manufacturers that essentially shape the look and the feel of a supermarket. And payments from food manufacturers to retailers, which is referred to as trade spend, determine which products are offered and how a store is laid out, which ultimately influences what we buy. So just to break down trade spend for you, since there's a lot of terminology, a common form of trade spend is placement fees. And these are the fees that a food manufacturer pays for placement of their products anywhere in a store. And these fees were originally opposed by manufacturers. They felt that grocery stores were implementing an unnecessary tax on new products. But over time, the food industry's largest manufacturers learned to embrace these fees because it gave them an advantage over their competitors. So over time, manufacturers have shifted from spending on traditional advertising, as you can see in this pie chart, and that includes like radio or TV, to in-store marketing. Now placement fees are paid for introducing new products as well as for renting shelf space for months or years. Today, food manufacturers pay a total of $50 billion a year to supermarkets to price, place, and promote packaged foods across the store. So within the umbrella term of placement fees, we also have slotting fees, and these are what manufacturers pay to introduce a new product onto store shelves. We also have these so-called one-time events, and these are the promotions that usually last a few weeks and occur like 6 to 8 times a year to give a particular product high visibility. So this can happen like around the Super Bowl or Easter or Halloween, where we have these one-time events. So to illustrate how these deals actually work, we can take checkout, for example, which is essentially the beachfront property of a supermarket. Retailers sell the space by the inch, and we've heard from brokers that its cost is about $3 to $5 an inch. So say you want to place your candy bar at checkout and you assume you need 6 inches for one candy bar, and you want to display it for a few months at checkout. So in Safeway's 1,300 stores, that would cost about between a quarter and $500,000. So it's quite a steep fee to get your products placed on shelves in major retailers. So these fees essentially determine which products are in a supermarket and where. And the concern here is that consumers reasonably assume that a product is where it is for reasons other than the fact that a manufacturer paid a lot of money to put it there. And you can also imagine that these steep fees can make it really difficult for a small food manufacturer to get their products on a grocery shelf. And so this ultimately all factors into consumer choice, because in supermarkets, most choices are made for us before a product even hits the shelves. I also wanted to touch on this practice called category management, which is formalized through contracts. So this is where a dominant manufacturer of a product essentially is deemed the category captain, and they are able to decide not only where their products are placed, but also where their competitors' products are placed. So for example, with this image, this shelf we see right here of like mayonnaise, you can see that Hellmann's is the category captain for this product, and you can see that their products are displayed, at eye level, dominating the ideal places to catch a consumer's eyes, whereas their competitors' products might fall lower on the shelf. So the companies paying these fees are largely selling packaged goods, and therefore these are the types of products that are dominating a store. Produce companies and their trade groups face significant challenges in competing for prime store space because they neither have the market share nor access to capital to be able to afford trade fees. So say you're at the store and you forget to buy bell peppers, you're not going to see them again after you leave the produce section, but if you want to buy soda, you're going to see it several more times. So what do we do about this? CSPI uses a 3-pronged approach, and our ultimate goal is to have policy change. So the way that we work with organizations and companies, so we encourage companies to make voluntary changes, and we also provide technical assistance to advocates, local health departments, and community-based nonprofits that are interested in transforming their food retail environment. Currently, a lot of our work has focused on checkout, but we're interested in other parts of the store as well. Okay, so I'm just gonna go through a few examples of the work that we're doing around the country. So in Berkeley, in 2017, we led a healthy retail workshop in California just to bring advocates interested in this together. While we were there, we met an advocate from Berkeley who wanted to partner with us. She was really active in the Berkeley's soda tax campaign and saw checkout as a next step for further reducing soda consumption in our communities. So she helped us identifying a local community group, which is BACR, Bay Area Community Resources, that would lead this work. We set up focus groups, listening sessions, and key informant interviews with people in the community that were most impacted by food access issues. And we also created an advisory group that was comprised of a diverse array of community groups like Healthy Black Families and the YMCA, and they basically weigh in on every major decision in this campaign. And advise us on who else to bring into this discussion. So after all this information gathering, we looked at all the data and evaluated checkout. We talked to retailers as well, and we engaged in some joint fundraising with them. And we've secured money from individual donors and the SSB Tax Commission in Berkeley to hopefully introduce a checkout ordinance later this year. And I just want to note here that if you're in a community where there are soda taxes and there's a commission that decides how money is spent, this is a great, healthy retail strategies are a great way to sort of take the soda tax work to the next level. So something to think about. Next, in Los Angeles, in 2017, we had a community group that was comprised of LA parents and public health organizations approached Northgate Gonzalez, which is a family-owned and traditionally Mexican grocery store in the region, and basically asked them to remove unhealthy products from checkout. So we were approached, and through a health department grant, we worked with the store to do a healthy checkout pilot, which they then scaled to 10 stores around LA with plans to expand. And as you can see from the image, the store developed marketing materials that were specifically tailored to the community. We also have a web video on our website about this project if anyone's interested in seeing more. Next, in Nashville, we were recently approached by American Heart Association representative in Tennessee who wanted to partner with us and the Davidson County Health Department because there's this concern that I'm sure a lot of you have heard about lately about the proliferation of Dollar Generals in Nashville and what this means for fresh food availability in the community. So this is still in the early stages, and we've reached out to Dollar General, unfortunately with no luck, but we're now going to be doing an in-store assessment in Nashville to see what the quality of the products is. And I think this one is particularly interesting just given all the recent media attention on dollar stores. Many of you may have heard that dollar stores are like an invasive species in communities around the country. They saturate the market and make it impossible for other grocery stores to move in some areas. And they usually set up shop in low-income communities and communities of color, and very rarely stock fresh fruits and vegetables. And so this is the new area for us. We haven't worked on any dollar store policies yet, but an approach that's being adopted in places like Tulsa, Oklahoma, is limiting the number of dollar stores that can be located within a certain distance of another. And there's a great Planet Money podcast on this if anyone's interested in learning more. Ooh, okay, I'm running out of time. Just another example is in East Lansing, Michigan. We had a parent advocate reach out to us who was really upset with the checkout choices in her community. So we started a education campaign there. And unfortunately with Meijer, which is a major retailer in the area, unfortunately we didn't get any voluntary changes from the supermarket, but we're now looking at doing a policy scan with them and working with the State Advocacy Coalition. I'm just gonna pop to the next one. Okay, so when we work with retailers, we usually focus on a few approaches. This includes doing a healthy checkout pilot to see how that changes sales, urging retailers to set nutrition standards at checkout, and also encouraging food and beverage manufacturers to get their better for you products into the mix at checkout over their unhealthy products. So some lessons that we've learned from this is that the independent regional retailers are often more flexible than the larger supermarkets. So for example, like I used to live in Portland, Oregon, and New Seasons is a local grocery chain there, and they did not accept placement fees for products there. We also try to work with stores that have a health as part of their mission, like CVS and Kroger, for example. We've actually, both of them have made healthy checkout commitments. So would recommend starting there. It's also very difficult for retailers to abandon their agreements with manufacturers, so we suggest getting a different mix of products from the manufacturer's portfolio, like for example, like swapping out Coke soda for Dasani water bottles. They can still stay in business with these manufacturers. And then an approach that we've been really excited about and talking about here and has seen some success is using public funding for fruit and vegetable incentive programs, which can also help support the overall health of a store. So this is happening in Seattle, where they've used the soda tax revenue to fund an F&B incentive program, and Safeway's involved with this. And the 3 Safeways that are actually operating in the food deserts in the city have seen an increase in their revenue since the program has started. So this is something to think about. Another thing to think about if you're in a community with a soda tax and are worried about retailer pushback. So just through our continued engagement with retailers, we've seen changes happening across the country. Aldi, Raley's, CVS, Wegmans, I won't go through the whole list, but they've all made changes at checkout and are starting to make other retail changes, like, for example, moving cereals high in added sugars off the eye line in grocery store shelves. And we have a case study about this for anybody who's interested, but in the UK, 9 of their major retailers comprising 90% of their food retail market have also made healthy checkout pledges. Okay, so just to quickly summarize that, again, our ultimate goal is to have policy change because it requires fewer resources, it reaches more people, and it sustains long-term change. So some approaches are, as I said, the healthy checkout ordinance, like we are working on in Berkeley. So while checkout only impacts one part of a store, we think it's a good place to start to garner interest in food retail changes. And we found parents to be fantastic advocates in this space, as I'm sure any parent out there knows that shopping with your children is really difficult when there's junk food all over the place and always at checkout. Another approach is licensing ordinances, which like, for example, would be like requiring licenses for retailers that sell sugary drinks and also including limits on the proportions of soda versus healthy beverages in the store. And then I won't touch on zoning since it's outside of the store, but the last one is limiting non-sale distribution incentives. Is kind of jargony. It's a relatively new approach, and it's actually been proposed in California at the state level, but essentially it's restricting incentives and payments that sugary drink manufacturers and distributors provide to retailers to promote their products. So again, this is a really new approach, and this bill hasn't passed yet, but this is exactly what we're seeing across the country that they've already done with tobacco and alcohol. So limiting in-store promotion, and it would have widespread impact because it would address the whole store. So, sorry, that was a lot in a short period of time, but that's it for me. Thank you so much. And I hope there is still time for some questions. And feel free, if anybody is interested in talking to me about healthy retail in your community, please feel free to reach out afterwards.
Thanks, Daria. We have our first question. At the beginning of your presentation, you mentioned that CSPI doesn't work with money from USDA or other government organizations. This person is wondering what's the thinking behind that? How does government funding chip away at scientific integrity?
I don't think it always has to. I think it's just for us to be able to know that everything is coming from our scientific interpretation and that there is no government or industry influence over what we're saying, especially because there have been times when we've gone head to head with the government on different policies like school meals that's happening right now. So I think it's more, it's not that government funding chips away at scientific integrity. I think it just gives us more flexibility to say what we want to say and speak the truth.
Thanks. And I think this is a question for both of you. Outside of policy, until these great policies pass, how do you convince store owners to prioritize shelf space for healthy products?
Allison, I don't know if you wanted to go first.
Yeah, sure. Wellness is top of the list for what retailers believe will differentiate them from others. So I think that there's increasing evidence that they're going in that direction anyway. So I don't think it's particularly difficult. I think I think candy at checkout is arguably, besides soda, maybe one of the most difficult areas. But the store is big. There's lots of product segments within that store, and so I think it's really not hard to ask them to prioritize shelf space in many cases.
Yeah, I think for us, we've done a lot of information gathering. So for example, in Berkeley, we did like focus groups and interviews, and we found that consumers largely wanted healthy checkout and were able to bring that to retailers there. So showing to them that is what consumers want, and then also, at least with some of the smaller retailers, they actually make more money off of like bottled water than soda. So I think the financial incentive is something that should be highlighted.
Do we have any other questions? I saw someone raise their hand, but it went away.
I will just say about the retailers, I think as long as they think they can make money off of it, or they're not going to lose money, they're more likely to be willing to try different options. We've done some supermarket studies in Baltimore, and I think that really is key for them, is that they can't afford to lose money. But that oftentimes isn't the case, that they don't lose money, but it takes a little bit of time for that to happen.
Yeah, I would say like piloting like one lane is a great place to start. See how this lane works. It's not a huge difference, and working with them on setting, we have nutrition standards actually on our website for anyone wants to see them, nutrition standards for checkout that you can bring to a retailer and say, why don't you try one lane and see what happens.
We've got about 5 minutes left. If there's any other questions.
One question I was messaging with Allison about was asking about the average budget for groceries per household, and wondering, does that include all groceries, or is it only food groceries?
Yeah, so that statistic was all food groceries, not necessarily only purchased in a supermarket. And the other studies that I referenced, I had another question just to clarify, is that it was only food, so not toilet paper or other kinds of grocery type products. So it's household weekly shopping expenditures for all groceries.
Thanks, Allison. And there's another question: is it better to have a health foods aisle / section, or to integrate those items throughout the store?
I don't know that there's one particular study, but there definitely is evidence for bringing together products that create a meal, and I never thought I would say this before, but a meal solution. A healthy meal all in one place that's also lower priced. There is evidence for that.
I would say it would be great to have healthy foods integrated throughout the store, and there should just be an aisle for the junk food, and that's where that stays. That's what we would like to see.
Well, it looks like we don't have any more questions, and we are at time. So we're going to go ahead and thank Dr. Allison Carpin and Daria Minovi for sharing their expertise and wisdom with us today. And we will send out the materials in the next few days from the webinar. So thanks to you both for joining us.
Thank you.
Thanks, everybody. Have a good afternoon.